Hello, today we're going to be talking about ankle problems and feet problems. So when you have foot pain, when you experience heel pain or heel pain here, or if you experience plantar fascia pain or possibly knee pain, you could have instability or joint restrictions in your ankle. And one of the tests that I like to do to see if someone has joint restrictions or joint hypermobility in that ankle is to have you stand up, and I want you to just take and bend your knees a little bit. And what you're going to look for in this test is when I bend my knees, do you see that your ankle collapses in when you do that action? And if you look at my left knee, my ankle is collapsing in on that side. Now, when that ankle collapses in that way, then your first ray has to rotate the opposite direction. Your great toe has to rotate the opposite direction. And the same thing happens with the tibia fibula as well as the femur. This has to rotate away and this rotates in, and it puts torque on the knee. So what you have to do in that case is somehow stabilize those ankles so that the ankle doesn't do an overpronated movement. And seeing one of our specialists can actually help you improve that and be able to see better if you have a problem that can be corrected with a simple insert or some exercises. Now, for those of you who have actual foot pain, one simple thing that you can do is see if you have muscles that are your stabilizers for your ankles that are actually working. And in order to do that, I want you to just take your shoes off and I want you to lift just your big toe here. Now, I don't want everything together. I want just the big toe to lift up. Now, don't be surprised if you can't lift it up. What that does mean is that your stabilizing ankle muscles aren't providing the stability that you need, and that could be because you have some joint restrictions or some stress or strain that's happening in a certain position, and that would require further testing at one of our clinics to see if that problem can be corrected by one of our specialists. So if you can't lift just that toe without lifting the others, then that just means that the muscles that stabilize the ankle are not present. Now, the next test that I want you to do is I want you to lift just the toes up and keep that great toe down. And I want you to do that without moving the ankle in. So I just want you just to lift the toes and not crank on that ankle. So for an example here, I'm just going to lift it and see how my ankle moves a little bit. That just means that I've got good activation, but I also have something else going on in my ankle. So if you're not able to do what we call here at our clinic toe yoga, then that's a good indication that there's something going on the ankle that needs to be further evaluated. And one of our specialists are happy to help you. So practice to see if you can do a toe yoga technique. If you can't do it, then kindly give us a call and talk to one of our front desk specialists and schedule an appointment with one of our mobility stretch coaches. We can actually look to see if you have problems in your ankle that are limiting the mobility in the ankle and placing torque on the knee. And we can also see if we can get you just into a program of strengthening to get the strength back in that ankle so that you have good stability to be able to walk, run, or play higher level activities. Thank you so much for taking this few minutes to learn a little bit more about foot mobility and stability. And if again you have any questions, please visit us at www.stretchphysicaltherapy.com. Have a great day.